20-second hand hygiene. Good morning. My name is Jonathan and I'll be your nurse for today. Can you get your name and date of birth? Okay, let me confirm with your wristband. Joe Shmoe, 1971. Nice to meet you, Mr. Shmoe. How's your morning going? Okay, did you sleep alright? That's good. Are you in any sort of pain? No pain? That's good. Are you allergic to anything? More specifically, are you allergic to tape adhesive, chlorhexidine, or latex? No? Okay, well, the reason I'm asking is because I'm here to change the dressing that you have right there. It's real quick. Is it okay if I can expose the area? Okay, thank you. Okay, like I was saying, I'm here to throw that old dressing and put a new one. Have you had this procedure done before? No? I would love to educate you real quick. So what you have right there is called a CVAD, which stands for Central Venous Access Device. This catheter is placed and it leads to your heart, and we use it to administer different kinds of medication and certain types of fluid. Throughout the procedure, if you notice that you're in pain, please let me know, and we'll administer pain medication. But just to reconfirm, no pain right now? No? Perfect. Okay, so what I'm going to do right now is I'm going to wipe the table for 30 seconds and let it dry for 2 minutes. Okay? Did you watch the Champions League game yesterday? Yeah? What'd you think? Yeah, I think Real Madrid's gonna win it again. They have such a stacked team. Yeah, I heard Mbappe is the new signing this summer. Yeah, that team is too overpowered. Okay, so what we're gonna do now is clean the sides, the edges. So everything's nice and clean. Clean this side, this edge. Perfect. Okay, discard. And hygiene. Okay, so while we wait for this to dry, I'm gonna go more in depth on what's gonna happen. So I'm just gonna assess the site, peel off that dressing, take off the blue thing, and then put in a new bio patch, and then put a new dressing on top of it. But before we begin, I just want to remind you that it is important for you to keep that mask on and turn to the left side. This is so you don't breathe on it and we prevent cross-contamination. I will also be wearing a mask because this is a sterile procedure. But before we do all that, I want to get you in the best position of comfort. Is this a good position right now? No? Okay, let me lower the head of the bed. Let me know when you're good. Good? Perfect. Now if you could turn your head to the left side. Thank you, that's perfect. And hygiene. Okay, so what I'm gonna do right now is I'm gonna gather my supplies. So my supplies consist of this dressing change tray and this bio patch. So what I'm going to do is place the bio patch here. And because you and I already have a mask, we really don't need this anymore. So we'll just throw this. These are my sterile gloves, which I will need. So I'm just gonna put them to the side for now. Bio patch. Open it up. And we let it fall. Ooh, blue side up. All right. feels like the one. Throw this away. And hygiene. Okay. So I'm gonna assessing the site. Everything looks all good. Okay, so what I'm going to do now is I'm going to put on my gloves and remove the dressing. Okay, I'm just gonna stabilize the patch and peel. I'll make this as gentle as I can. So far so good. Discard this. Now I'm going to remove this bio patch. Throw it away. Throw away my gloves. And hygiene. Okay, so now I'm going to assess the site. I see no redness, no swelling, no inflammation. I'm looking at the tube for any cracks or leakage. I see none. I'm also looking at the length of the tubing, making sure it's the same as it was previously charted, and it is 5 inches, same as 7 days ago. Perfect. Okay. So now what I'm gonna do is I'm gonna put on my sterile gloves. Okay. Perfect. Okay, so let me just, again, let you know what's gonna happen. So what I'm gonna do right now is that I'm going to clean the site around 2 inches, clean the tubing, and then we're gonna let it dry for 30 seconds. After that, I'm going to place the blue bio patch, and then after that, I'm going to place the dressing, and then we'll be done. Sound good? Okay, perfect. Okay, so what I'm going to do now is I'm going to hold this. Now, because I'm holding this hand is not my contaminated hand, so I cannot let go. I grab the chlorhexidine and I'll clean around the area. And then we also clean the tubing up on all 4 sides, up and up. Okay, we discard, and then we grab our bio patch, taco style. We insert it. Perfect. Okay, so what I'm gonna do is gonna put the dressing on you, and then I'm just gonna leave the wrapper by your side real quick, and then after we're done, I'll just throw it away. Sound good? Okay. So grab this. Perfect. make a stress loop. Perfect. Then I want to place this dressing. Clear any air bubbles. This right here. Perfect. So now what I'm going to do is I'm going to put this tape sorry about it, just can't find the tape. Where did it go? Nice. Okay, here we go. I see it. But I can't get it. There we go. Sorry about the wait. Okay, perfect. Now I'm gonna sign my name, initials, and date, and time. It is 5:30 to 29:24. Okay, and now what I'm going to do next is I'm going to discard the materials. Remove my gloves. And now what I'm going to do is I'm going to document, make sure make sure that I document there was no swelling, inflammation, redness, that the length was good, no cracks or leakage. But overall, how was it? Okay. No pain still? No? Perfect. Okay. And it seems like you've tolerated it pretty well, right? Perfect. Okay, well, that's all. I'm completely done here. Call light is within reach. I'm gonna lower the bed in the lowest position, and let me know if you need anything. Okay? Perfect.